What's up, YouTube? It's me, Courtney, ECPI RN graduate / registered nurse official, coming at you with an update. So today is May 25th. It is 10:09 a.m. and I am like wide open. It's like a freaking, what's today? Wednesday. I just dropped my kid off and I'm just like, ah. So I needed to update y'all. I've been trying to do this for like probably about 2 days now. I actually made a video, but then when I went back and watched it, it was all over the place. So I was like, nope, gonna redo that because it looked ridiculous. I didn't have like my normal list that I normally have. And so, yeah, I was all over the place with that. So I'm not even gonna, post that. I'm just gonna post this one because I made a list. So I am currently in week 6 of my orientation with Centera as an RN on ICU. New grad RN on ICU, if anybody needs that kind of update. So, I already told you all about the first week. So I'll go from week 2 on. So week 2, there are a lot of classes. So Centera is really, I don't know how other companies do it, but I'm really surprised at how much education we get in orientation. So I've taken so many classes, and to be honest with you, I've been like exhausted because the classes are all during the day, but when I work the floor, it's at night. So I might work the floor Sunday night and have Monday off, and then Tuesday, Wednesday have to work day shift to go to classes, have Thursday off, and then Friday night and Saturday night I'm working. So it's pretty insane. So I've been like, my sleep patterns have been kind of trash. Like, I know for sure after I do this video, I'm gonna go take a nap because I'm tired. But week 2, so we did skin rounds. So we actually went around with the wound care nurse, and she kind of told us about what she does and when she works. And we got these. So they give us like badge buddies for everything. So this one is all about pressure injuries and how to stage. But they were very specific in saying that you didn't have to stage. They actually don't want you to stage. They just want you to, document what you see. So if it's non-blanchable erythema or whatever, or if you see the borders, or if tendons and muscle is visible, that's what they want you to post. Not say stage 1, stage 2, stage 3. They don't want you to do that. So that was nice going around with her. And then we also had to take a class about wound vacs, how to apply them. It's like, it's really crash course in nursing, like all the important stuff that you need to work in the hospital and on your floor. And then we did this nursing bundle that's like Centera specific, so I won't get like too much into it, but it just talks about like the care of the patient in the hospital, the discharge, and then what we do afterwards or whatever. And then I got to work the floor on my second week, so super excited. My preceptor's name is Dee. She's amazing, absolutely amazing. She's a great teacher. She does everything like it's perfect. I love her. We have a good vibe. And so that was week 2. Week 3, I worked the floor, just the floor for the week. So that was great as far as my sleeping pattern goes. Week 4, I had to go back over to the sim center because we did like a mock, and it was just half day. It wasn't full day like it was last time. And thank God my half was the afternoon half, because getting there early in the morning, oh God, ugh. Excuse me, I'm very sorry. I'm yawning here in my videos. So we did like a mock code and a mock MRT, and it was good. That's, mannequin, sim center, shout out to all my nursing students. Y'all know what that sim center is like. It's trash. Nobody likes sim because they want you to do all this stuff. And it's like, what's my patient? You know, like it's, I don't know. It's just odd because I think the Sim Center is good. It's great. Like the concept is great. But when you're actually doing something and they want to know your response, like everything has to be kind of like textbook. But when you've been like with actual patients, you know, like, yeah, you're giving me steps 1 through 5 to do, and I have to do them in this order. But literally, if this happened on the floor, I'm probably going to do all 5 of these at once, or all 5 of these are going to happen at once, and then there's going to be like 2 other people doing them with me. So it's kind of like, it's odd, but still very good learning experience. Still, Sim Center, whoa, super organized, down to the minute of what you're going to be doing. Love it. I worked the floor, and then I had time to do CBT. So I am not a fan of going to work just to do CBTs. I think that's actually kind of ridiculous when I can do them at the computer at my house. But I understand people previously were saying, okay, yeah, we're doing CBTs, but the CBTs that they would get done, like, yeah, I did 8 hours worth of work, but you only got like 45 minutes to an hour worth of CBTs done in that 8 hours. So I can understand, but I'm not that type. If I'm doing CBTs, I'm doing CBTs, and that's just that. So whatever. Working the floor was great again. So the times that I worked the floor, I know D was on vacation, and then I had some military stuff, so we weren't together. So I had a couple different preceptors. They were all good. Everybody's good up there. Everybody, I love the fact that on the floor, everybody is, it's like a team. Like, you have your 1, 2, 3 patients, whatever, but you're still actively working with other people's patients. And then like you go in and like, if you know, if your nurse A is me, nurse B has a patient here, and then they just got an admit that is a train wreck, so they're in there with them, and their patients are calling. So nurse A is going to go in and do whatever their patient wants, or pass whatever medications the patient needs, document on it, and that's going to be it. So it's not like, you know, when nurse B comes out of train wreck, they're like, hey, yeah, I passed this med for you, I did this for you, la la la, and then that's it. So I absolutely love that about ICU. I don't know if it's like a Centera thing or if it's an ICU thing, but I know that when I did clinicals while in school, that was not a thing, like at all. Like, you got your patients, I got mine, which kind of sucks. So that's that. Week 5, last week, oh my God. So I did this EKG. So you have to do like a basic arrhythmia course. So Monday was the basic arrhythmia course. Tuesday, I had to go to the monitor tech room, which was like a part of that whole basic arrhythmia thing, because the monitor techs monitors the EKGs throughout the hospital. Awesome. They were awesome there. They really helped. So like I was like cross-eyed in the basic arrhythmia course because I'm like, what the heck is this? But the next day, going to the monitor tech room and actually sitting 1-to-1 with the monitor tech was absolutely amazing. And Tess is her name. She helped me like crazy. We did the homework together from the basic arrhythmia course, and she really explained everything to me. I felt really good. Like I was like, oh, I don't have to go to this another class. But when I went, I really, oh my God, it was so beneficial to me. I loved it. Plus, monitor techs do not monitor ICU patients. ICU nurses do. So I actually need to know this information. She did a great job of explaining everything to me. I can't like elaborate on that enough. Wednesday, it was a CBT day. Thursday, we actually had like clinical orientation, and that was like a full 8-hour day. But we went through a whole lot of stuff with just day to day in the hospital. We went over sepsis. We went over, oh, goodness gracious. We went over a whole lot of stuff. There's a lot of classes. They were all like 45 minutes to an hour. Different people came in, pharmacy came in, you know, it was like a crash course in a bunch of different topics. So it was really good. And then Friday we had the basic arrhythmia course again. This time with the basic arrhythmia course, it was just a review for the most part, and then we had to take a test. And it's a 3-part test that you have to take, or you cannot take care of patients that are monitored with EKGs. So has to be passed. First 2 tests, you have to get an 80 on all 3 tests in order to pass. So like the first 2 tests, I got like an 80 81.5 and then like an 81.3, which was okay. Yep, I passed. And then like that third test, oh my God, I took it so many times. It was ridiculous. I just could not get it. And then, so I said, you know what, I'm gonna take a break on this. That was Friday. When I went back in on Saturday to try to do it again, the system, which is called Workday, was down. And so I said, well, that's, you know, God's sign. I don't need to do this today. Whatever. And then Sunday I worked Sunday night, so I didn't touch anything. And then I went back in Monday and took the test again. And I found that I think I probably was just cross-eyed because it was a lot of stuff that was like, okay, yeah, you did good with this part. Like, you got all the readings right, but you picked the wrong, you know, your interpretation was wrong. Like, I did like normal sinus rhythm for a patient with heart rate of 50. Like, obviously that's sinus Brady. But, you know, I was making little dumb mistakes like that. So once I took it again on Monday, I actually passed like that. So it was great. This week, I worked the floor Sunday, like I just said, which was great. I actually had a lot. So I had like a true ICU patient, intubated, sedated, on a lot of pressors, on a lot of drips, heparin drip, quite a few pressors. And, you know, on ICU, we do a lot of titrating of medications. And so I asked Dee, because, you know, she was like, oh, the patient's blood pressure is low. He's running low. The last 3 readings were low. Let me go back in. I'm going to titrate this up or down or whatever. And I was like, okay, so what I need to know is, how did you decide out of all these drips which one you're going to titrate to get the response that you got? Which was correct, because she's really good, like I said. And she was like, you're going to have to do some drug cards. And I was like, ugh. But she's absolutely right. So I've been working on the drug cards. I just actually got done with a couple of them. Some of the drugs that we were doing with the drips, I had a list. Okay. Epinephrine, this patient specifically was on epinephrine, heparin, ketamine, Versed, Levo, and propofol. So all these drugs I need to kind of just like look into. And so I've done like 2 drug cards. And then they give us this critical care reference card, which tells you, I don't know if it's like really clear, but it's like all the drugs that are basically drips on ICU and how to titrate them. And so that's been good. We have a whole lot of these things. So they give us one for MRT procedures. So as an ICU nurse, you can be assigned to the MERT team, which is the medical response team. And, you know, because an ICU nurse has to respond. And then if it turns into a code or a code, you know, ICU nurse has to be there. So if you're the one that's picked for the shift to have to do that, then this little handy card will tell you what you need to do if whatever one of these things happens. So, for instance, the patient has chest pain. You want to do stat EKG, 0.4 milligrams of nitro sublingual Q5 times 3. If the systolic BP remains greater than 90, pull some cardiac enzymes. 4, 81 milligram chewable baby aspirin, and then call a STEMI alert. So, yeah, it tells you all these things to do. So it's actually really good. I actually really like it. And then we have our sepsis card. They give you all these badge buddies, pulling, you know, when you pull labs, like all the stuff. My God, I got a new badge buddy. It's cool. It says ICU nurse. I love it. But I feel like a cornball because I bought all this random stuff. But whatever. I'm still really enjoying my time. I got 2 more. Yesterday, we actually had a class. It was a 2-hour class on the IV pumps, which they use these ICU medical pumps throughout the hospital. They don't use the fun little Alaris pumps that we learned about in nursing school that were so easy to use. They use these different ones that are just a little more difficult to use, but very programmable, and they flow into the patient's medical record. So, you know, whatever. Had to take a class on it yesterday, 2-hour class. Off today, so I'm going to work on some of these drug cards after I take a nap. And then Thursday and Friday, I'm back on the floor. So I'm supposed to be off Saturday, Sunday, Monday, but I think I might switch my Tuesday to Sunday. So I'll be off Saturday, but I'll work Sunday, and then I'll have Monday off, which is Memorial Day. My son's school is closed, so that'll be fun. I'll be off with him, and then yeah, on to the next week. So things have been going really good so far, guys. I would like to have more time on the floor, but I understand the need to complete all of this computer-based and, in classroom portions just so you're ready. Because I do feel more ready after I do those classes, or if it's something that I'm fumbling around with, like the IV pump, than to take the class yesterday. I was like, okay, yeah, this was beneficial. So yes, this video is like super long, way longer than what I like to go into, but wanted to update you all in the past few weeks. I am on my 6th week of orientation, so I'm halfway through, and things have been going pretty good so far. All right, questions, concerns, comments, whatever, drop them down in the bottom. I will get to you as soon as possible. Courtney J. RN, out.